They tried to silence the doctor who saw the future. In the 1990s, a doctor in the United Kingdom began warning the healthcare system about something deeply uncomfortable. He saw patients being pushed through hospitals, clinics, surgeries, and waiting rooms as if healthcare was only about access to doctors. But he saw something others refused to see. Every unnecessary visit to a hospital was not just a visit, it was an exposure to infection, an exposure to resistant bacteria, an exposure to a future where antibiotics may no longer save us. He questioned the system. He challenged unsafe triage. He warned that doctors were being replaced by protocols, tick boxes, and people who were never trained to think like doctors. He said healthcare must not become a mechanical process. It must remain human. It must listen to the patient's story. It must identify danger early. It must separate fear from real illness. But the system did what powerful systems always do when someone threatens their comfort. They ignored him. They dismissed him. They tried to silence him, because accepting his warning meant admitting that the system itself had become part of the danger. For years, hospitals were treated as temples of safety. People believed the answer to every symptom was simple. Go to the doctor. Go to the hospital. Get antibiotics. Get tests. Get treated. But what happens when the hospital itself becomes colonized? What happens when antibiotics stop working? What happens when the very place we run to for safety becomes the place where we acquire the infection that may destroy us? That future is no longer far away. It is already arriving. Hospital care is declining. Waiting lists are growing. Doctors are exhausted. Nurses are overwhelmed. Antibiotics are failing. Operations that were once safe are becoming dangerous. Cancer treatment, intensive care, childbirth, surgery, transplants, and even simple infections now face a threat humanity has never experienced at this scale before. This is the post-antibiotic era. And the painful truth is this: the old healthcare model cannot save everyone. A system built on dependency will collapse when too many people rush towards it at the same time. That is why Maya was created, not as another app, not as another symptom checker, not as a machine pretending to be a doctor. Maya was created as a beacon of hope, a way to help people pause before they panic, a way to help families understand whether symptoms are minor, serious, infectious, or dangerous, a way to protect people from unnecessary exposure, a way to guide them towards the right action at the right time. Ask a chemist, speak to a nurse, consult a doctor, isolate, go to hospital, not blindly, not fearfully, but intelligently. Maya helps prevent, Maya helps protect, Maya helps heal. Because true healing is not only found in hospitals, it begins inside us, in awareness, in calm thinking, in knowing when to act and when not to panic, in understanding the power within the human body, the human mind, and the human story. The healthcare profession tried to silence the doctor who warned them, but history has a strange way of revealing the truth. Kodak invented the digital camera and ignored the future. Healthcare was warned about the post-antibiotic era and ignored the future. Now the question is no longer whether the warning was right. The question is, how many lives will be lost before the world accepts that healthcare must change? The age of blind dependency is ending. The age of intelligent self-protection has begun. And in that new era, Maya may become the bridge between fear and wisdom, between infection and protection, between hospital collapse and human survival, because the future of healthcare will not belong to the systems that silence truth. It will belong to those who listened before it was too late. Maya is not here to replace doctors. Maya is here to protect humanity before humanity reaches the doctor too late.